Hi, I'm Leanne and I'm an exercise physiologist at Active Health Clinic, and today's short video is all about POTS. So we're going to discuss what is POTS, the diagnostic criteria and some of the common symptoms. So POTS stands for Postural Orthostatic Tachycardia Syndrome, and by definition POTS is an increase of heart rate with standing in combination with a collection of symptoms that are orthostatic intolerance in nature. So POTS is actually a disorder of our autonomic nervous system, where it's not working quite as well as it should. So our autonomic nervous system is a branch of our nervous system that is involved in all of our automatic or involuntary functions of the body. So things like managing heart rate, blood pressure, respiratory or breathing, digestion. So basically everything that we don't need to actively think about. Our autonomic nervous system is involved in maintaining our blood pressure throughout different postural positions. So managing the change in our blood pressure from when we go from laying to sitting or sitting to standing, our body needs to detect these changes in position and adjust our blood pressure accordingly. So when we do go from sitting to standing, the body detects this change and adjusts. The blood vessels actually constrict to assist with blood flow back to the heart. Whatever blood gets back to the heart then gets pumped out of the heart and around the body, including up to our head and our brain. So in POTS, with that postural change, there's not enough blood getting back up to the heart, which means the heart is not filling to the ideal capacity, and it's not able to pump as much blood around the body as it would like, which therefore means that there's less blood getting up to the head and the brain, which is why in POTS it's common to experience things like headaches, maybe migraines, lightheadedness as part of this. So basically in POTS, that autonomic nervous system is not working as well as it should, which is impacting the blood flow getting back to the heart with postural change, and therefore to the head. When this happens, the body detects that this is not quite working, and as a counter, the body starts to pump the heart a lot faster. That's where we get the tachycardia from, to try and correct this, and that's where we get all of the other symptoms of POTS in an effort to try and pump more blood around the body. So the diagnostic criteria for POTS is an increase of heart rate by 30 beats per minute in adults or 40 beats per minute in teens, so those aged 12 to 19 with standing, along with chronic symptoms of orthostatic intolerance. So low blood pressure is actually not a part of POTS, and this is often misconstrued. So again, POTS is the Postural Orthostatic Tachycardia Syndrome, so it's more to do with the tachycardia and diagnosed by heart rate, along with those symptoms of orthostatic intolerance with the tachycardia. So some of the common symptoms with POTS, which can go across a lot of systems in the body, can be things like the racing heart, the heart palpitations, there can be chest pain, shortness of breath, dizziness and lightheadedness are common, fatigue, the brain fog and concentration difficulties, heat intolerance as heat challenges blood pressure, exercise intolerance. There can be some gut symptoms like nausea, and some people experience heaviness or tingling in their legs or their feet, sometimes some discoloration as well, as that's where the blood might be pooling. So I hope this short video has helped with understanding POTS a little bit more, and feel free to have a look through our YouTube for more information on POTS as well as some information on POTS management.